Assalamu alaikum. My name is Rachid Siddiqui and I'm a student of third Prof Evening. The topic of my presentation is Fibroadenoma. Now I will start my presentation with the recitation of Surah Kahf. Bismillahirrahmanirrahim. Qala amma man zalama fasawfa nu'adhibuhu thumma yuradu ila rabbihi fayu'adhibuhu adhaban nukra। तर्जुमा जुल्करनैन ने कहा कि जो कुफर और बदकारी से तुम करेगा उसे हम अजाब देंगे, फिर जब वो अपने परवरदिगार की तरफ लौटाया जाएगा तो वो भी उसे पूरा अजाब देगा। नाउ सेकंड आयत, व अम्मा मन आमना व आमिला सालिहन फलहु जज़ाअनिल हुस्ना व सनक़ूलु लहु मिन अमरिना युस्रा। तर्जुमा, और जो ईमान लाएगा और नेक अमल करेगा उसके लिए बहुत अच्छा बदला है और हम अपने मामले में उस पर किसी तरह की सख्ती नहीं करेंगे बल्कि उससे नरम बात करेंगे। नाउ मूविंग फॉरवर्ड towards a hadith. Bismillahirrahmanirrahim. An Abi Umama qala Rasulullahi man ahabba lillahi wa abghada lillahi wa ata lillahi wa mana'a lillahi faqad istakmala al-iman। तर्जुमा, हजरत अबू उमामा रज़ियल्लाहु अन्हु से रिवायत है कि रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम ने इरशाद फरमाया, जिसने अल्लाह ही के लिए किसी से मोहब्बत की और अल्लाह ही के लिए दुश्मनी की और अल्लाह ही के लिए दिया जिसको कुछ दिया और अल्लाह ही के वास्ते मना किया और ना दिया जिसको मना करना और ना देना अल्लाह बेहतर समझा तो उसने अपना ईमान मुकम्मल कर लिया। Now moving forward, case study 1. A 15-year-old patient was admitted in the hospital having fibroadenoma. Now objectives. Mass in left breast developed for 1 year and symptoms include no pain, no discharge, no redness. There is gradual increase in size with no history of weight loss and discharge from patient history. A patient has menstrual history observed irregular with irregular periods for past 6 months, along with 2 months once 3 to 4 days. Increased passage of clots on examination. A pallor, conscious oriented growth is observed. The BP was in the range of 110/80 and the pulse rate was noted to be 80 beats per minute. The blood group of patient was B positive. Other investigations include fine needle aspiration, cytology of left breast which show benign breast disease. Serology was negative and there was left breast firm nodule in upper medial quadrant having 4 by 6 centimeter size. Diagnosis include iron deficiency anemia, fibroadenoma, along with 20/8 URI. The plan was to improve hemoglobin levels and then do surgery. Treatment starts with blood transfusion as shown in this picture. Temperature of patient was normal body temperature 98.7 Fahrenheit. Pulse rate was 78 beats per minute and respiratory rate was normal 20 beats per minute. The BP was 10 to be 110 to 70 mm of Hg. As the patient was outpatient, so Livogen tablet was administered for 15 days 2 times a day and another tablet known as PAN was administered for 15 days 2 times a day. Other drugs and their doses, route of administration and frequency are given in the table. Now moving forward, pre-operative treatment. Before surgery, the following injections were administered, including DT injection, Xylo injection, having test dose, and Taxim injection. Discharge summary: patient was advised to take augmentin tablet along with Nicolite SR capsule and Shericosine, and he was advised to have more iron-rich food so his hemoglobin level can become normal. Now moving forward, case 2. A 28-year-old woman was presented with a lump in her left breast that she had noticed during a self-examination. As family history, the lump was painless, firm and mobile, and had been present for about 6 months. The patient had no family history with fibroadenoma. Diagnostic procedures include a mammogram and ultrasound, which shows a 2 cm well-defined mass in the upper outer quadrant of left breast, illustrating fibroadenoma, and a core needle biopsy was performed under ultrasound guidance, and the result showed a benign fibroadenoma. The treatment includes the surgical removal or close monitoring with follow-up appointments. Basically, the patient was given choice: either he could have surgical removal of fibroadenomal tissue, or he could be closely monitored with follow-up appointments. So the patient, after discussing with the doctor and his family members, chose surgery. So surgery was performed under general anesthesia, and the lump was successfully removed without any complication. The pathology report confirmed the diagnosis of fibroadenoma. Now moving towards case study 3, patient profile. A 20-year-old woman with bilateral breast lumps and pain of 8 months duration was admitted to the hospital. She also had menarche at age of 13 and is going through regular menstrual cycle. In her family history, she had no family history of breast disease, contraceptive use of drugs, and no comorbidities. Diagnosis include ultrasound and fine needle aspiration. The ultrasound shows multiple well-defined echogenic masses with lobulation at different positions, that is multiple fibroadenoma. Basically, multiple fibroadenoma demonstrate growth of fibroadenoma in more than one position. Fine needle aspiration also reveals cohesive clusters of ductal epithelial cells, one of the major components of fibroadenoma. Now moving forward towards treatment. Treatment includes surgical excision of breast lumps under general anesthesia. During surgery, lateral inframammary incision and reflection of breast from pectoralis was done. And after surgery, 11 lumps which were found were removed successfully from breast tissue. As shown in this picture, there are multiple breast lumps removed from the patient breast tissue, and the second picture demonstrates the right breast from the pectoralis muscle of the patient. Moving towards case study 4, A 30-year-old female patient was admitted in hospital having firm, mobile, smooth breast mass at 12 o'clock position. In this case, also there was no family history of fibroadenoma. The diagnosis in this case also includes ultrasound, which show well-defined lobulated, horizontally oriented, hypoechoic breast lesion of 200 mm size. Fine needle aspiration cytology also reveals lesion growth that confirms fibroadenoma, and stain elastography shows green and blue mosaic benign pattern. As you can clearly see, ultrasound confirming the growth of fibroadenoma tissue in the breast. Now the treatment includes surgery to remove lesion. After surgical procedure, patient remained in hospital for 2 days and then discharged with strict dietary precautions. Now moving towards last case, a 60-year-old female patient was admitted in hospital with palpable upper outer quadrant left breast nodule, and the patient does not show any family history with fibroadenoma. Proceeding towards next slide. The diagnosis includes mammography. Mammography is basically X-ray of breast, which show a 1.2 centimeter oval shaped nodule in the upper outer quadrant of right breast. Ultrasound did also show solid lump with cystic area, and fine needle aspiration also show unusual biphasic tumor that confirms fibroadenoma. These are some of the pictures which are taken by fine needle aspiration using different types of gels composed of different compositions. Treatment includes biopsy, which is basically removal of that particular part or tissue to remove less lumps. Thank you.